We are Team BEATDABETES, proudly presenting Retina Lab. Visions are vital. In the present, diabetes is the second leading cause of deaths in Thailand after strokes. Diabetes mellitus, a disease characterized by high blood glucose level, is also one of the 4 main types of non-communicable diseases in Thailand.
It has been reported in November 2023 that there are about 5.2 million diabetic patients out of the total 66.5 million Thai people, with type 2 being the most common. According to the Ministry of Public Health of Thailand, the prevalence of diabetes will continue to rise at the rate of 300,000 per year in Thailand, which is a result of 4 main risk factors, including age, obesity, low HDL value, as well as the behavior of eating sweet food, as observed in a study of diabetic patients from 5 Thailand patients. Diabetes type 2 usually progresses over time, and patients can also develop microvascular and macrovascular complications in addition to the diabetes main symptoms. Examples of complications include heart failure, strokes, angina, neuropathy, nephropathy, retinopathy, and leg claudication. The importance of treating these complications should not be overlooked, as they can highly affect the quality of diabetic patients' lives. In this video, we will focus on the second most common complication found in 30.7% of diabetic patients in Thailand 2011, that is retinopathy.
As shown from the statistics presented previously, currently the healthcare system is faced with a larger burden every day due to the increasing number of patients being diagnosed with diabetes, which leads to problems such as longer queues in public hospitals, low supply of medical resources that are not able to keep up with the increasing demand, and shortage of medical professionals. This results in low patient satisfaction towards our current healthcare system in Thailand. This is why we're trying to put forward a program that we believe will help solve those problems. Our program aims to increase patient satisfaction by making the patients' lives more convenient and flexible. How? Well, our program involves working with various hospitals so that when patients are first diagnosed with diabetes, they're recommended by the doctors to monitor the development of diabetic retinopathy complications by going to the optic shop for follow-ups every 6 months, and are given an orange paper with a referral letter from the hospital, which can be handed to the optic shop for acknowledgement. This will be a lot more convenient for patients who are still working full-time or older patients, because instead of going to the hospital, they can rush to the nearest optic shop when faced with any symptoms that could indicate an eye problem, such as blurred vision. Additionally, this will help distribute income to optic shops in Thailand. More people will be employed as a result of this program, and the workload on doctors will be reduced. Now let's talk about the program in more detail.
The 2 key components that are required for our innovation are the image input system and the artificial intelligence system. First, we need to use fundus photography to get a retina image, and this machine is fundus photography. Fundus photography utilizes specialized camera equipped with powerful lens and illumination systems to capture high-resolution images of the retina. The process involves directing light into the eye and precisely focusing it on the retina to obtain clear and detailed images. The camera then captures this image, which can be digitally stored and analyzed. Now, let's go through the steps of the procedure. The first step is preparation. Begin by preparing the patient and ensuring that the room is darkened to facilitate pupil dilation. For a second step, administer eye drops to dilate the patient's pupils, allowing the better visualization of the retina and minimizing the effects of light scattering. Next, position the patient in front of the fundus photography machine, ensuring proper alignment of the eyes with the camera. The fourth step is alignment. Adjust the camera settings and focus to ensure optimal image quality and clarity. Then activate the camera to capture multiple images of the retina from different angles, ensuring comprehensive coverage from the entire retina. Lastly, review the image to ensure they meet quality standards and provide sufficient detail for analysis. The image or the output of the fundus photography is a series of high-resolution images, showcasing its various structures such as the optic nerve, blood vessels, and macula. These images provide valuable insights into the health and condition of the retina, allowing clinicians to detect abnormalities such as retina detachment, diabetic retinopathy, and macular degeneration.
Let's look into the AI that we plan to use in this project. First, our basic idea is that the AI would use the supervised learning convolutional neural network CNN algorithm and learnable data to train the AI model. The AI would take the image of facial retina as an input and then grade them into 6 groups according to Thailand Clinical Practice Guideline for Diabetes 2023. Normal, mild NPDR, moderate NPDR, severe NPDR, PDR, and the presence of macular edema. After we get the useful AI, we also need someone that can help us use the AI. Someone who have trained it to fully define the terminal in the local gas shop. Local automasis. The automasis would take a picture of facial retina into the central server where our AI is stored. The result from the grading and the picture would be stored in the server using NoSQL database technology such as MongoDB, which is suitable for horizontal data expansion. A copy of the result would print out for the patient, when the patient happen to be in the severe group or higher. The result will be marked for the doctor to make the appointment as soon as possible. Here is our workflow. For each time the patient comes to check up, the optometrist take a retina picture, then upload it into the database. Our image processing AI would grade them into 6 groups. The patient and the hospital doctor get the results. Then we manage according to the guidelines and the patient needs. Subsequently, we can tailor treatment based on each patient's specific need.
After hearing all of this, many people might be wondering and may start doubting if our program is going to be successful. Therefore, we have planned out 5 main points to ensure that our program will be successful. Firstly, we trained a supervised learning convolutional neural network algorithm to create a high-quality artificial intelligence system that can generate precise diabetic retinopathy grading. Secondly, we made a simple to-watch video to instruct optometrists on how to work with our AI and program. Users can also make a call to the call center if they have any further questions. Thirdly, we need the National Health Security Office cooperation in setting up a central server and integrating our program's features with the application to make user service payments easier. The fourth point is encouraging various optic shops to participate in our project by setting up the opportunity for the shops to claim this project as a tax deduction. The last point is to publicize our project through the hospital by creating videos, posters, and informational brochure. To make the project sustainable beyond the first 3 years, we will split the work into 4 aspects. In order to finance the project, we plan on asking the government for support funds. Furthermore, because we have a specific amount of reserve funds, we can be guaranteed that our project won't encounter a financial problem. In terms of encouraging optical stores to keep on collaborating with us, when they involve in the project, they will benefit from tax deductions. Moreover, it's assumed to be an effective way of promoting the shop and raising the chance of getting more customers. For public relations, in order to inform new patients about the project, we will keep promoting it through the hospital and the patient's attending physician. When it comes to the application development, feedbacks from users will be gathered and set to use in order to create apps that even better satisfy user needs.
Next, we're going to tell you how the $1 million budget is going to be allocated to help make the program a success.
$1 million fund would be spent by 62%, while the other 38% would be kept as contingency. 65% of the amount would be used up in the first year and 70% in the second and the third year.
The first year amount would be totally about $400,000, which would be divided into $56,000 for AI developing, $250,000 for copyright of AI software, $850 for promoting, $2,200 for website modified for optic shop, $300 for instructional media for staff education, $11,000 per month for employee salary, and $280 per month for employee welfare costs. For the second and the third year, the cost structure is the same. The cost of it is $106,000 each year, which would be divided into $560 for promoting, $700 for website maintenance costs, $8,500 per month for employee salary, and $280 per month for employee welfare costs.
Now, let's hear from an expert and optometrist with experience in using the fundus camera.
โครงการนี้ค่ะช่วยให้เราสามารถช่วยคัดกรองผู้ป่วยเบาหวานให้เขาสามารถรู้ตัวแล้วก็ระวังตัวในการใช้ชีวิตของเขาได้มากขึ้นค่ะแล้วก็ยังช่วยให้เขาไม่ต้องไปเสียเวลาในการคัดกรองเบาหวานที่โรงพยาบาล
Lastly, let's not wait until diabetes turn into blindness. Thank you.